One of the big questions that comes up after having the baby is, what am I going to do for birth control now? Because you've had your baby, congratulations, and now you're realizing that it's a lot harder than you thought it was going to be. You're up all night, and by golly, you don't want to have a baby right away. You want to put that off for a little bit. So what birth control is safe to use after having a baby? There's classically sort of a couple of considerations. One is whether or not you're breastfeeding. And there are issues that can happen with the hormones in birth control in general with breastfeeding, and we're going to talk about that. The other is something called a DVT, which is basically a blood clot in the legs. And what happens is, right after having a baby, you're at increased risk of getting a blood clot. It's still very rare, but if it happens, it can be really bad. Some birth control can increase that risk of blood clots. And so that's another thing that's considered. So let's cover that one first, because that's pretty easy. Estrogen-containing products can increase the risk of blood clots. It's still a very rare thing. But because of that, most people think that we should wait until about 6 weeks after birth before we give you an estrogen-containing product. For instance, birth control pills contain estrogen. Now, it's sort of interesting the way things work in the United States. The Food and Drug Administration forces anybody that puts out a hormonal birth control method to put all the warnings for birth control pills. So even if the method doesn't have estrogen, they still have to have the warnings about blood clots. But the truth is, most people believe that progesterone-only methods don't give blood clots. So for most of us, we feel comfortable using a progesterone-only method right away, right after you deliver. But from a practical point of view, usually it's the 6-week mark is when we start people on birth control. And it's really historically for that reason. So most of the time we'll wait till 6 weeks. You're really not supposed to have sex before you come to your 6-week appointment anyway. And then we start you on a birth control method. And that's really the main reason why. It is important that you don't have sex before that 6 weeks. And if you are going to have sex, make sure that you use a condom. It's not uncommon to have somebody come to my office for their 6-week postpartum check and they're pregnant already. So usually that's not good news. So you want to know that you can get pregnant within a month after having the baby. So you have to be careful about that. The other issue is breastfeeding. And there is some concern that if you start a hormonal contraceptive too soon after breastfeeding, that it could keep the milk from being established well. And so most people don't like starting on birth control until about 6 weeks postpartum, because by then the breast milk is well established. We used to believe that we should start, if you were going to use a birth control pill, that we should start what's called the mini pill, which is a very small dose progesterone-only pill while you're breastfeeding. And the issue is that breastfeeding has some contraceptive benefit in and of itself. And so the mini pill, even though it has a high failure rate, in conjunction with breastfeeding, actually has a pretty reasonable success rate. The problem with that strategy is that at some point you're going to start weaning the baby or introducing solids or introducing formula. And if you don't switch over to a normal birth control pill, you're really at risk of getting pregnant. Recently, we've come to understand that as long as you wait till 6 weeks after delivery, you can use any birth control method when you're breastfeeding and it's safe. And so that's something that some of us older doctors may still have a problem with, younger doctors probably less so. But the truth is that as long as you wait 6 weeks, any birth control available on the market right now is safe for breastfeeding. So you really have all your options open to you. And I personally don't prescribe the mini pill anymore for people breastfeeding because I really don't think there's much benefit to it. And I've seen too many pregnancies 4 or 6 months down the road when people start weaning their baby. So the good news is that after you've had your baby, most of us will wait 6 weeks, but then you can have any birth control method you want. There are birth control methods that are safe immediately after having your baby, and those are mostly the progesterone-only methods. But for the most part, most people wait till about the 6-week check.